when you create a pilot, while you're helping to manage maybe that tension between budget and requirements and helping to support kind of that buy-in from your organization, you're creating a little bit of a mirage environment that doesn't create that real kind of all-in rollout. And at the end of the day, what we often find is a little bit of bias from the users saying, well, I know it's a pilot, so I'll give it a little bit of time to show that I've contributed or I've thought about it or I at least looked at it. But you sort of end up with a little bit more of a smile sheet and them going sort of gut reaction, whether they like it or they don't, versus really having it embedded and gone through that full change management process that would be done had it been rolled out at scale. So for me, pilots are just one of those strategies that I see applied very frequently to manage that tension, but it doesn't always resolve in the way that I think people hope at the outset.
That's really interesting. Michael, does this resonate with you from your years leading home health and hospice operations at Bayada?
It most certainly does. So before I jump in, I also want to make sure I thank Eleos and Christy for the invitation to be part of this conversation. As we'll get into, I led our home health practice for 10 years, hospice for 3 years. So I still I'm a physical therapist by profession, so I'm a clinician, but I think of myself as an operator. Now I'm in a research role. And the reason I'm in that research role is how do we figure out how to operationalize this stuff as efficiently as possible to keep up with the new technologies, but in the service of better care for more people.